If you struggle with neck pain or tension for any length of time, you've probably noticed a frustrating pattern. It feels stiff, so you stretch it, maybe you crack it, maybe you massage it, and it'll feel better for a little while. Then the next day, it's right back where it started. If that sounds familiar, there's a good chance you're only addressing one piece of the puzzle. Your neck doesn't work in isolation. It works as a system. And if you really want lasting improvement, you have to look beyond just where it hurts. One of the biggest misconceptions about neck pain is assuming the painful area is always the source of the problem. Sometimes it is, but many times the neck is simply compensating for limitations elsewhere. Every time you look over your shoulder, reach overhead, lift something, or even just sit at your desk, your neck is working with your upper back, shoulder blades, shoulders, and the muscles that stabilize your spine. If one of those areas isn't moving well, isn't strong enough, or isn't coordinated efficiently, your neck often has to work overtime. Those extra demands can contribute to pain, stiffness, and constant feeling of tension. That's why simply stretching doesn't always solve the problem. Sometimes those muscles feel tight because they're working overtime and making up for other pieces of the puzzle. Anytime I'm working with someone that has neck pain, there are 6 common areas I'm always going to evaluate and treat. Not because they necessarily need all 6, but because they're all a part of the same system. The first is the most obvious. I'm going to look at neck mobility. We're going to look at if the neck truly is stiff. We're going to improve mobility that can help restore normal movement, reduce stress and irritated tissues, and make everyday activities like checking your blind spot while you're driving more comfortable. If your neck isn't moving well, this is an important place to start. The next place we're going to look is your thoracic spine, which is your upper back. Your thoracic spine is designed to rotate and extend, and if it becomes stiff, your neck often has to create extra movement to compensate. Improving mobility through the upper back can reduce unnecessary stress on the cervical spine and make the neck move much easier. The next thing we're going to look at is neck strength and stability. Mobility is only half the equation. Your neck also needs strength and control. The deeper muscles of the neck help stabilize the cervical spine during movement. If those muscles aren't doing their job well, larger muscles can often have to work overtime, which can contribute to fatigue and tension. Building strength and stability in the small stabilizing muscles of your neck will help you become more efficient instead of simply more flexible. Next, we're going to look at shoulder blade control. Your shoulder blade serves as the foundation for nearly every arm movement. If it isn't moving or controlling movement effectively, your neck muscles frequently jump in and help stabilize the shoulder. Improving shoulder blade control helps distribute the workload even more evenly instead of asking your neck to do everything. Next, we're going to look at shoulder mobility and overhead control. Your shoulder should be able to move freely overhead, but mobility alone is not enough. You also need good control throughout the motion. If your shoulder doesn't move efficiently, your neck often compensates by elevating or working during overhead activities. Restoring both mobility and control can reduce those unnecessary demands on the neck. And finally, we look at the big picture of postural strength. This is where we bring everything together. Having the strength and capacity to achieve and maintain optimal postural positions is vital. Posture is not everything, but there's value in having the strength and endurance to maintain good positions when your body needs them. Improving postural strength helps your neck, upper back, shoulders, and trunk work together more efficiently throughout the day. It's less about sitting perfectly and more about giving your body the capacity to move well in various positions. The biggest takeaway is this. If your neck pain keeps coming back, don't just ask, what can I do to my neck? Ask, what part of the system could be contributing to my neck pain? Sometimes it is just the neck. Sometimes it's the upper back. Sometimes it's the shoulders. And often it's a combination of several different factors. That's why successful rehab isn't about chasing symptoms. It's about identifying the impairments that matter most for you and building a body that is strong, mobile, and resilient. If you found this helpful, be sure to subscribe and visit activeindependentrehab.com for full rehab plans designed to help you understand your body, move with confidence, and take control of your recovery. Let's get moving.